Hello, ladies and gentlemen. Welcome to another episode of the Father Talks podcast. Today on Father Talks, we are joined by Dr. Elliot Justin. Dr. Justin is the CEO and founder of FernTech, a sex tech company, focused on men's erectile fitness and the connection between sexual health and overall health. With a background in emergency medicine, healthcare technology, and men's wellness, Dr. Justin brings an honest medical grown folks perspective to a conversation many men avoid until something is already wrong. Dr. Justin, welcome to the show.
Great to be here. Thank you.
Thank you. So, listen, ED is something most men have experienced. And if they say that they haven't, they're either lying or extremely lucky.
They're all
So,
lying
okay.
because
All right.
it's just because because we really have misdefined ED,
Okay.
and a lot of ED is frankly just aging. If we don't mind just jumping right into it.
Yeah, please.
So what's erectile dysfunction? Well, according to the International Society for Sexual Medicine, here's the official definition.
Okay.
First clause: inability or difficulty getting an erection. Well, aside from alcohol or excessive drug use, most men actually don't experience that. Most men get it because the second clause is difficulty maintaining erection. All men experience that. So the first clause, men who can't get an erection or struggle to get an erection, I don't mean because it's, hey, you're with someone who really turns you off. I don't mean because you've had too much to drink. And men know this because we all masturbate too. Men know this. You know, if they can't, if you can't get an erection, struggle to get an erection with yourself, that's real dysfunction. That's what I call a dying dick or a dead dick. And you need to do something about it. If anyone listening to this show has that problem, you need to see a cardiologist and or a urologist. And why is that? Because the urologist and the cardiologist call the penis the canary in the coal mine of cardiovascular and sexual disease. So these guys who struggle to get up or can't get up on a regular basis, they're not getting enough blood into their penis. It's all about plumbing. It's all about blood flow. The heart's a pump. The pump is not working well because atherosclerosis, heart attack, angina, congestive heart failure. And then there are pipes that come out of the penis. Excuse me, the pipes that come out of the artery. The arteries that come out of the heart and go to the penis, the pipes. And then they're narrowed due to diabetes, hypertension, or calcification, atherosclerosis. That's 12 to 15% of men, and that's a big problem.
Right.
But the second problem, getting an erection and losing it, all men experience that, and that's multifactorial. And that could be, hey, you're not turned on by the person you're with. Maybe having that third cocktail was a mistake, or maybe thinking you're 75 years old, you can dance till 2 o'clock in the morning and still perform. Maybe that's a mistake too. Maybe smoking that entire joint that your son gave you, that was a mistake. Maybe, or you're taking medications that we doctors, my perspective, wrongly prescribe to people without warning them about the sexual side effects. Many of the antihypertensives, anti-blood pressure medications, almost all the antidepressants, the antidepressants, these are erection killers, or they make it very difficult to stay in erection.
Yes.
If you're taking those medications and you're having problems, there are alternatives. You need to talk to your doctor about getting off those medications, getting on other medications. Or it could be that there's a baby crying in the next room, or you're worried about paying the mortgage, or something happened with the kids. And so you get an erection and you lose it, but you're getting an erection. So you're getting blood in. It's really not dysfunction. It's just there's a problem going on. And the PD5 medications, which are the erection pills, the Viagra's, the Cialis, the Tadalafil, they put more blood in. That's nice. Take them. But if you're getting an erection and losing it, the primary problem is not getting blood in. It's keeping blood in. And there's only one thing that will keep the blood in: an erection ring. And Michael, if you had told me 4 years ago, Dr. Justin, you're going to be talking about erection rings the rest of your life, I would have said, like most men, no effing way. I'm good. I don't need it. And now I realize it's not about being good. It's about being great. Look, I'm 73 years old. Michael, you're a couple years younger than me, but you're probably in the same bracket. I don't want to presume, but
yeah. Hey, listen, no, I can tell you right now, listen, I have zero problems admitting this. I was on some medication for a while, being treated for PTSD and bipolar disorder. And listen, it completely shut the party down, and I really had to have some conversations with my doctor because, I mean, this this impacts your relationship, you know,
and your
and
mental health,
yes,
and practically every pretty much every aspect of your life. You know, men. I like to say that men are only as good as the last 3 erections. I mean, a guy who's failed 3 times in a row, he probably should have his guns taken away from him. Maybe he shouldn't be allowed to drive over the speed limit. But it's and here are some medical facts about it. I want to circle back to what's wrong with the way in which we treat this problem. Men who have sex every day cut the cortisol levels, the stress hormone, by 30 to 50%. Why our psychiatrists should be recommended this? Hey, if you're feeling you're feeling bad, start masturbating. You know, the I, I have had men. One friend of mine who has PTSD from the war in Iraq. Actually, I was joking round about it with him. This is like 5 or 6 years ago. And he said, I've been too depressed to masturbate. I'm going to make myself masturbate every day. A month later, the guy was happier. 2 months later, he's dating again. He like just, oh, well, it's kind of like exercise. We don't like to think about approaching sex as exercise, but maybe we should sometimes if we have a problem. But if what we've done is medicalize and create shame about, EDs, dysfunction. Guys don't talk about with their doctors. They don't talk about with their friends. What they do is they go online, they get pills because they're easy to get. The pills pull a little more blood in, great. But the pills don't keep blood in, nor do the pills tell you what's going on. So one of the devices that we manufacture here sell here is a tech ring. It's the world's first monitor of the health of penis. It will give you the data about your duration of firmness, your erections. You can then start thinking, what's causing this? What's the problem? So with data, you can actually track it to hack it, as opposed to just guessing about what's going to work. But if you're getting hard, you need to put a ring on it. And men need to open their minds about rings, because guys associate rings with, oh, gay guys do it, or and by the way, they're smart to do it. Gay guys do it, and I'm good. I don't need it, and it's a mistake.
well, and listen, I can tell you, so prior to us getting together today, I've been looking at uh, the website and that, and we're talking about the tech ring, you know, and I'm just gonna ask you, hey, how does all this work? For you guys who are listening, so the tech ring is essentially a ring that goes around your penis, and as Dr. Justin said, you know what, it tracks the health of your penis essentially. So what I guess what got you into this? Because listen, you may be saving a lot of marriages and a lot of men's lives right now.
It's changed my life. It changed my marriage. But I got into a background in emergency medicine physician, and I'm probably saw about 175, 180,000 people in the course of my career.
Okay.
And I can tell you, short of a heart attack or a stroke, there are a few things that concern a guy as much as a limp dick. And when Viagra first came out, before it was widely available commercially, before you go online, just and get
Just buy it anywhere.
just buy it, right? Um, guys would come in on Friday or Saturday nights back in the '90s, like 2 o'clock in the morning. My dick's not working. I need a pill. It's an emergency. Uh, and and if I certainly know from being a doctor, if you actually take the time to speak to people, if you ask people, as I did late in my career before I moved on to technology, if you start to ask people about their sexual health or every guy, to your point earlier at the very beginning, every guy says, yeah, there are times I can't get it up. We doctors never ask, and we should ask. And the key
Right.
question is, you can't get it up, or you get up and you lose it. But um,
Excuse me.
I got into this really through emergency medicine. I became interested in remote patient management technologies. So many people going to the ER with problems that they don't need to be there. I mean,
Right.
this device that we all have, these smartphones. I mean, even homeless people have these devices. These devices are smarter than 99.9% of the doctors in the world.
And
And
we
90
and
not
we use
nine,
them to track everything.
yeah. So I thought, what information could people get on their smartphones using wearables at home that will
Right.
both educate people so they can prevent having problems, and helping them to manage and diagnose problems more intelligently because they now have data. So we live, Michael, in this incredible age of smart wearables, smart watches, smart rings, smart everything. And this is gap. And the gap is sex. and yet sex is so important to us, that, to everyone. It's kind of shocking that, because the technology that we're using, and I'll show you in a second, was around 20 years ago. What we're doing should have been invented a long time ago, and there's something peculiar that, maybe, about our culture, that it wasn't thought of earlier. Instead, we basically, when it comes to every other area of the body, Michael, if you came to me and I was your doctor and you had a problem with your heart, your lungs, your kidneys, bones, I could get an imaging test and blood test that would help me understand what the problem is objectively. It wouldn't be just you're telling me, "Hey, Elliot, I think I have high blood pressure. My face, I get kind of flushed and weak, and when I exercise." If I told you today, or if you came to me and said, "Hey, Elliot, my pulses are regular and I work out," and I said to you, Michael, "Oh, Michael, that's cool. You take this pill and come back in 6 months," you would think, "What the heck is this? 1900? Are you going to
Right.
electrocardiogram? Are you get an echo test? It's a blood test?" But when it comes to sexual health, doctors are basically passing out pills and injections and exercise regimens without any data whatsoever, and that's kind of 1900 medicine. So 4 years ago, a urology professor at the University of Utah told me he wanted to count the number of nocturnal erections that men have, and I knew nothing about them. And I said, "Well, okay, why?" And he said, "Well, because they're a leading indicator of a man's cardiovascular and sexual health. This is really important. Medicine, we don't have a lot of leading indicators. A leading indicator means it's predictive. It's the lead. We treat high blood pressure and stroke. Obviously, we treat high blood pressure aggressively with pills, but yet they're just association, except at the extremes. So, for example, my blood pressure is 110/70. If it goes to 130/80, does it really tell me anything? Now, if it goes to 200 over 120, it's telling me that's a loud signal. But
Right. Yeah.
but for
So
most but most of these variations are minor. When we throw pills out, the same thing with liver proteins. I mean, if your cholesterol goes from 180 to 240, what does it really mean? Now, if it goes to 400, that's a problem. But we jump all over these things. But when it comes to men's sexual health, we just pass out pills. Now, there's
right.
a really famous urologist, maybe the most famous urologist in the world. His name is Mohit Khera, Khera. He's at Baylor University, Texas. And he says, quote, "Viagra is Vicodin." Now, what does he mean by that? He means that yeah, if you have a problem and just take a pill, you could be masking, missing a more. You might be one of those 12 to 15% of men who has a heart problem or a diabetic problem, and your dick is
Mhm.
trying to tell you about this problem, and you're ignoring it. Instead, you're taking a pill. So, I mean, I have no problem with a guy 25 years old who's, dating strangers on this, who decides to go out and, take a pill because it'll boost his confidence. I have a problem with a guy your age or my age, Michael, and you're younger than me, who's having problems going online and taking pills without getting a workup of his heart and his
Right.
sugar profile, things
So
of that nature.
yeah. So here's a question then. Um, for instance, what is what is the stigma? You know, because again, hey, listen, I can tell you this was not something I wanted to talk to anybody about. My pride was killing me, you know, but I ended up getting some help. But why is there such a stigma behind men getting actual treatment for this, or even having a conversation with their doctor about it?
Well, you might want to say culturally we're inhibited. Well, compare us to the Arab world or South, I mean, we're at highest instances of erectile dysfunction are in the
Yeah.
Persian Gulf and Southeast Asia. Uh, so we're not I mean, relatively speaking, things are better off here. Absolutely speaking, yeah, we are inhibited about talking these things, but I think it's because well, there's multiple issues. One, there's just male pride. But
Okay.
another issue is, and this, pe- there's no money in it. What people don't get about healthcare, or starting to get now, is you get the healthcare that can be billed for. You don't
Right.
necessarily get the healthcare that you need. So we doctors, we talk, people want to talk about how, oh, it's just embarrassing to talk about, sex. Well, it's embarrassing to talk about shit, piss, vomit, diarrhea, pus. And we doctors we talk about all sorts of, yeah, all sorts of things that are, I mean, sex at least is pleasurable. We talk about all sorts of things that are disgusting, relatively. So why don't doctors ask questions about sexual health? I mean, I've never had a doctor ask about my sexual health. My wife, who's You're younger than me, she's 72. She's never had a doctor ask her about her sexual health.
Yeah, I can say that I've never had a doctor ask me,
Well,
unless
here's
I brought it up. I've never had a doctor, ask any questions about it.
here's just the cold fact for people. Healthcare today is dictated by the electronic health record.
Okay.
Matter of fact, today when we go to doctors, often they're not even talking to us. They're talking to a machine or they're dictating. They're not even paying attention to us. The average doctor family doctor intern spends less than 10 minutes actually speaking with someone. And for a urologist, it's 7 minutes, according to a big study. Well, they're only going to ask the questions that lead to them getting money. How do they get money? For every cyst, for a doctor to conduct, like a primary care doctor, internist, to conduct, he has to, in order to be paid by money by Medicare or whatever insurance carrier, I'm Medicare age, you have, they have to review a certain number of systems. Well, there's no box for sex. So if if there was a box, so I'm going to make up a number. I think so. I forget the exact number. They have to review out of 7 or 8 out of 11 or 12 systems. Your brain, mental health, lungs, heart, kidney. All these things. Uh, they have to review it's like 7 or 8 systems and check boxes, and they're supposed to ask certain questions. Although the truth is, they often lie. We got because they don't have a lot of time. So they're checking boxes, but there's no box for sexual health. If there was a box for sexual health, they might at least ask that key question for men: are you having difficulty getting it up, or are you having difficulty, keeping it up? But there's no box there. And when it comes to men's diagnosing men's sexual health, they do. If you go to a urologist with a problem, they only do what's going to give them money. So the emphasis uh, has been on treating. If a man does have ED, bad ED, I don't mean a guy who gets up and loses it. I mean a guy who struggles to get it up. The emphasis is on the heart and the arteries because the doctors have diagnostic tests that they can. Let's talk about money. They have tests that actually assess the heart or the arteries. They don't have any tests, though, that they can assess what you mentioned earlier, which is your medications. There are no tests that's gonna tell a doctor, "Wait a second, Elliot, it's the SSRI," or, "Wait a moment, Elliot, it's the calcium channel blocker that he's taking, a blood beta blocker that he's taking the blood pressure." If those tests existed and doctors can make money checking and performing those tests, that would happen. Now, it turns out that most men's problem is keeping blood in their penis. Well, that's the venous side of the circulation, and there are no tests for the venous side of the circulation, except for an in-office Doppler, and it's fuzzy. There's a lot of variability between operators. It's not that reliable. Now, if there were a series of blood tests and vascular tests, interventional tests that could look at the venous side of circulation, then you
Okay. All right. So real quick, and because I know we're up against time and whatnot, let's talk about Tech Ring and the erectile fitness data because I am extremely curious about this. I've never seen anything like it, and I listen, guys. Guys need to know, no matter what your situation is, this is something they need to hear about. So, explain to us exactly what the Tech Ring
sure.
measures.
We've embedded sensors into the world's smart. I'm not calling it cock ring. I like calling it erection ring because cock ring makes it sound like a sex toy novelty. I mean,
Right.
there's a pressure sensor here. There's a strain gauge in the hook. It goes on differently. It doesn't go down the shaft.
Mhm.
You drop your balls in.
Uh huh.
It opens and closes with a hook, so it's easy on, easy off, and it sits like that.
Uh huh.
As
Okay.
the penis expands in size, it presses against the pressure sensor, pulls on the strain gauge, and gives the computer 2 data points that can then interpret to a 1 to 10 firmness scale for your erection. And we can also, of course, measure how long your erection lasts. A healthy man has 3 to 5 nocturnal erections per night. A healthy man's nocturnal erections are average about a 6 on a 1 to 10 firmness scale, and healthy man's has 3 to 5 per night, and they last about 35 to 45 minutes per erection. If that number comes down by 50%, a man has a close to 50% chance of having a significant heart issue or vascular issue in the next 2 or 3 years. It's a leading indicator. It's predictive. And I'm
Right.
confident that in the future, this will become part of the standard work of certainly middle-aged men, going forward, because you want to find out what your date is so you can then track it just the way you want want your blood pressure, we electrocardiogram.
So why are the nighttime erections, why do they matter?
No one knows. No one knows. So they matter for two reasons, though, and no one knows why they occur. So just
Okay.
briefly, what happens when you have a nocturnal erection? Your sympathetic nervous system, the fight flight part of your nervous system, shuts down, stops working. The parasympathetic system that allows erections is unopposed, and you get an erection. And then for whatever reason, 35, 45 minutes later, it turns off. And no one knows why they happen. The doctors want us to hypothesize that it's necessary to provide blood to the organ overnight to keep it nourished. But then why do young guys have so many? Or why does someone, so I don't think we know why they occur, but we do know is that the two arterial systems that are most sensitive to narrowing to vascular disease in the body are the retina and the penis. It's really,
Right.
these small arteries will get blockages way before your heart, where the arteries are bigger, gets blockages. So decreasing blood flow in these two areas and the penis will manifest itself as decreased duration of firmness of your erections, decreased number of your erections is a leading indicator of your cardiovascular and sexual health. And if men track this data, they can get early signals of problems. And we're all, Michael, all men are on the road from erectile fitness to erectile dysfunction. We all
Right.
want to maintain our fitness. Well, it's a lot easier to maintain your fitness if you have data about what's going on. On this road, look, if I were to, I don't get in my car and drive around without a dashboard. I drive my car with a dashboard. I don't want to have crashes. I don't want breakdowns. I want to know, hey, my engine fluid is running low. Well, men can now do that with their sexual and cardiovascular health by monitoring their nocturnal erections.
Okay. So, all right. So let's go through some of the products. Okay. So if I was looking to, test out my erectile, health, what would be the first thing that you would recommend that I do?
A man your age should get the tech ring. And why is that? Because the tech ring will give you the vital signs of your sexual health. It can also be adjusted. It's also an erection ring. It can be adjusted and made tight around the shaft of your penis to enhance your performance. Um, and that's our premier product. We're in the Google and Apple stores. It's easy to use. You download the app and you're connected. We provide notifications like, "Hey, Michael, you're having twice as many erections this month as last month, man. You are awesome. Way to go. Maybe just put that out in your social media, dude." Or it could be, "Hey, Elliot, your duration of your nocturnal erection has gone down by 20%. If this pattern persists, you should consider seeing your doctor about this." It is interactive, in that sense. Um, but the in order to count the number of nocturnal erections overnight, assess nocturnal erections overnight, we had to solve what I call the cock ring problem. What's the cock ring problem? These rings have been made the same way for the last 150 years. They're essentially O rings made out of hard silicone. You pull it out. You have to have an erection for it to work because if it's going to choke off the arterial blood flow. And then you slide this thing down the shaft of your penis. It pinches. They're uncomfortable. It never really caught on among straight guys. And after 20, 30 minutes, you want it off because you cut off the circulation. It's uncomfortable. It's like it's like lynching your penis. Who wants to, lynch their penis? Not me, not you. I'm certain. So,
I'm the hard pass.
but in order to count the number of erections overnight, we have to come up with a material that will allow the arterial blood to flow in and only constrain the venous return. When I say constrain, I mean imagine a sink with the tap still turned on, but you now have a plug covering it, 55, 65% of the way. So, our rings are made out of a soft elastomer. Arterial blood can flow in. And then having come up with a device that could be worn overnight, I realized, wait a second, I now have solved the problem that these hard silicone rings you get in the sex toy store for, $15, they pinch and they're uncomfortable. We've invented a device that not only can give men the vital signs, the data of their sexual and cardiovascular health, but that can actually optimize their sexual performance. How? Here are the questions that all guys should ask themselves. And again, I can make fun of myself because 4 years ago, my attitude would have been, "Hey, I'm good. I don't need it." Well,
Full of all of us,
yeah,
every man. We Hey,
We want
I
to be
got a
great. Well, how do we get to be great? So here are the 5 questions guys should ask themselves. I'll ask you, Michael. Michael, do you want to get harder than before? Ever?
absolutely.
Okay. So how do we do that? We compress the superficial veins, and by doing that, we increase the girth of most men by about 3 to 5 millimeters. Now, that's that much, Michael. Michael, unfortunately, no one's gonna walk by you and say, "Fucking porn star, man. Look at you." But, uh, but that increase in girth is more than blood you can hold in your penis with a hand, a mouth, a vagina. The more blood is held in your penis, the more sensitive it is, the harder you are. So you wanna get harder. Okay, that's one. Second question, do you wanna be more confident? As in, "I just had a 3rd cocktail. Am I gonna I know get up, but can I get it off?" Or, uh, "I just, you know, I've had this problem. I got this issue at work that's on my mind. I can't turn it off, but I know it get hard, but I know it's gonna come back to me." All those things go away because you put a ring on it. You can have negative thoughts and you're still gonna stay hard most of the time. I
Hey,
mean, so you want to be more
I
confident.
love the
That's
sound
another
of
one.
that.
Do you want your partner to be more confident? Because if what is a woman or a guy, for that matter, who loves their partner? Um, they're thinking about your pleasure too. I mean, what's the average woman thinking about when her husband or boyfriend's going down on her? Is he gonna be hard when I'm done? Am I taking
Yeah.
too long? Well,
Well,
if he's got a ring on, hey, take 20 minutes. It's still gonna be hard. And as you and I both know, as all men know, a guy who's not worried about losing his erection is good to go. A guy who's worried about losing his erection, he's probably gonna lose it. Uh,
yes.
so so both parties more confident. Do you wanna last longer?
Every man's answer to that question better be yes.
Yes. Now the last one. Do you wanna have more intense orgasm?
Hell yes.
Yes. So how do we do that? So, we do that by putting the right amount of pressure over the urethra to draw out the ejaculation.
Okay.
So, we did a study of and we did this study with using our maximum performance ring. The study of 28 men aged, uh, 20 28 to 70. And, the goal was to come up with the right amount of stretch and grip of the elastomer that the ejaculatory phase would increase by 50%. So my ejaculatory phase with, our maximum performance ring, I can achieve the same effect with tech ring by making it tighter, but
Right.
my ejaculatory phase goes from 4 seconds to 7 seconds. Well,
Woo!
that's and that's not the glow, the orgasm, the glow, if you will. That's just the ejaculatory phase. Well, if you draw out the ejaculatory phase by 50%, that's an incredible orgasm. And I don't have sex without a ring anymore, and my wife doesn't wanna have sex with me without a ring either, for all the benefits that I mentioned previously.
Right.
Put a ring on it.
Listen, I'm gonna tell you right now, an increase that listen, people think, hey, few seconds, that's not a big deal. That's a huge deal. That is a
It is
huge
huge.
okay. And I don't know about you guys, but you know what? Some of us are gonna get fat. Okay, because after 7 second, after you know, getting off for 7 seconds, okay, listen, I'm gonna need to eat if I don't pass out. Okay. So I might as well just keep milk and cereal right next to the bed at this point because oh yeah, okay.
We have had some younger guys, hit go from 5 seconds to 12 seconds. I mean, these guys are like almost comatose afterwards,
Yeah.
there are 2 papers comparing the ring to 10 milligrams of tadalafil or Cialis. Um, and we were looking at the time it takes for erection to go down after climax, solo. Then there's been one study during intercourse to get to a second. So, with nothing, it was like 25, 35 seconds. You get an erection, have an orgasm, down 25, 35 seconds. With, tadalafil, it's about 2 minutes. With, another one of our products, the performance ring, which is a tight a ring that actually for men a little bit larger. With a performance ring, it was about 3 minutes, and with the
Mhm.
ring and the dowel together, it was over 4 minutes. And the takeaway for all men from those 2 studies should be, you wanna optimize your performance, take a pill and put a ring on it. And then the other study looked at men with significant ED. I don't mean ED because you lose your confidence. I mean guys whose ED was such that they were taking pills and they were injecting, half of them, a prostaglandin to get an erection, and they still could not have satisfactory intercourse for more than a few minutes.
Okay.
It
Real quick,
a
stop
hun
it right there. What
a hundred
was
sorry, go ahead.
their no, 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 I'm sorry. I just wanted to, clarify. What they're injecting what now?
Prostaglandin. It's called
Okay,
Trimix. It'll produce it will it's what men who are desperate do.
okay.
It's what guys do before they get an implant. Now, there are guys doing it for parties. That's all. They're not supposed to be doing it for parties, but, uh, it is a party drug, as well too. I'm not recommending because frequent use can lead to scarring and can lead to curvature of the penis. But, there are guys who are doing it regularly either because they need it or because the whole confidence issue goes away. But anyway, the men in this particular study were men who could get hard enough to have to penetrate, and then they would lose their erection in 2 or 3 minutes. These guys were injecting and taking pills, and they were failing. By adding the ring, 100% of these men were able to have intercourse for 10 minutes, and on average to stay hard for 8 minutes after they had an orgasm. That's the power of the ring.
Listen, we're gonna be talking. Yeah, I'm definitely gonna post this all over on social media. Sorry,
Let
listen,
me let me
I'm
let
not
me
embarrassed. You know, as we get older, anything that I know, let's put it this way, I know a ton of guys who are struggling with this issue, and we've talked in private and everything, and I think this would be a welcome a welcome opportunity, for guys, hey, listen, man, I need to get this looked at because I can tell you right now, nobody, including myself, when I was having my issues, nobody thought about, hey, cardiovascular health, hey, maybe I need to see a urologist. These weren't even conversations we had. It was just the first thing was like, hey, you know what? It's probably your medication. Here, take some more medication.
Yes. Yeah.
Right.
I had a I had a patient about a month ago who was, taking, a dose of SR antidepressants, and we told his doctors that he was depressed because he was unable to climax. His doctor doubled his dose. Yeah. Anyway, you mentioned before, here's some other benefits of regular sex that guys to think about. Having an orgasm per week cuts your rate of prostate cancer by 50%.
Yes.
Having sex 3 times a week decreases your risk of cardiovascular death, sudden cardiovascular death, heart and arrhythmia by 50%. Uh, if hey, the benefits of sex are profound, and men our
Lady,
age, you want
no,
prescription?
oh, no, no, I was just about to say, ladies, you hear that? Sex is good for our health, if
You're
you
killing
want us
us.
around. Yeah, yeah, listen, we need it at least 3 times a week, and you heard it here from a doctor.
Hey, they might need it every day for their mental health. Uh, the and all men should know what their testosterone levels are as well too. That's another
Yeah,
neglected area. Just the way you should know your baseline nocturnal erection data, duration and firmness, you should know your baseline
okay,
testosterone. A lot of men today are low T, and that problem can be rectified. And with utilizing the tech ring, you can right dose it. Right now, if you're a man, you go to a doctor and you are low T, they put you on an average dose for a man your age. Well, Michael, I don't know about you. Actually, I do know about you, a little bit about you now. Michael, I know you, like me, you don't want to be average. You want to be optimal. You want to be optimal. You want to be, I don't want to be getting a C. I want to be getting an A minus at least. So
it
I want,
minimal.
I don't want my free T. I want my free T to be in the 25 to 35 range. I don't want to be 15 to, 20. So, or less. Uh, and the ring can provide people again with the vital signs of every guy's most vital organ.
Okay, when we're getting treated for ED, give us the first 3 things that we need to assess. Hey, we're not is it medication? Is it, drinking? Is it weight?
Yeah. Well, the first thing you need to do is find out whether the problem is psychological or physical.
Okay,
So how does the ring do that? Well, what the database for the ring now has 250,000 erections in it on over 4,000 men. So you're now comparing yourself to a significant number of men within 5 years of your age. So you can find out whether you're average, below average, or above average. Uh, so that's a start because if you're having above average number, not average or above average number of nocturnal erections for your age, and above average duration of firmness as well, and you have a problem, it's probably in your head or it's probably alcohol, given alcohol, and then other things. And it's probably in your head or it's alcohol or related. Now, on the other hand, if a man is having 2 or less nocturnal erections, that you can see a doctor. That is a cardiovascular urologic problem until, proven otherwise. Could be medication, but until proven otherwise. So the data itself can tip people off as to whether the problem is physical or whether it's mental. And then, of course, you have some idea of where to focus. Uh, you know, and we've had men get cardiac catheterizations because the data was poor, and we've had men get not get penile implants because the data was good. They
Right.
thought, like, my I just can't perform anymore. And then, oh my God, I'm having 4 nocturnal erections. Maybe the problem is in my head or with my wife or some other factor, but not a physical factor.
Well, I can tell you right now, it listen, I could lose an arm, okay? I could lose both. Let's be honest, I could lose both fucking arms. As long as my dick still works, you know what? Life is cool. And listen, people can laugh, but there is not a man right now who would say, "You know what? No, I'm cool, my dick's just not working." Not a chance. Not a
No,
chance.
not a chance.
I'd sacrifice most limbs. Hell, I'd sacrifice going blind as long as my dick still works. So that is my goal right there is, make sure as many men hear this as possible because I know we're struggling with it and none of us are talking about it.
And most of us just have a problem. We actually don't have dysfunction. I'll pick on you for a second, Michael. Give you an
Okay.
example how we fuck guys up with this. Michael, do you run as fast now as you did when you were 20 years old?
Shit, no.
Michael, you have a bad case of RD, running dysfunction. And and I've got a whole series of exercises, medications, supplements. Come give you some money, but I have all this whole, and I can fix your RD because you got it bad, dude. You got it bad. So we just we you know we for the reality is for most men, a ring is an answer to their problem. But guys don't are not used to thinking about used to thinking about pills, and we also get saddled with this idea that erectile dysfunction. It's like so negative. Men really get dumped on. We got
Yes.
mansplaining, toxic masculinity, porn addiction, the love grip. We don't talk about women this way. I mean, back when I was young, Michael, probably when you were a teenager, we talked about women as being frigid, hysteric, anorgasmic, cold, back in the 70s and 80s. And the feminists came along and said, you can't talk about us anymore that way, which is fine because these things are really shaming and negative. And then women also got vibrators. The But today, men get dumped on, and it makes it hard for us to talk about the things that are really bothering us. I mean, you got a problem and you want to bring it up with your partner, and then she tells you you're mansplaining. God, F you, come on, bitch. I'm trying to talk
Right.
about things that are important to me here. Anyway,
Right.
and the same thing with dysfunction. Sorry, go ahead, Michael.
Oh, no, no, no. It's fine. I'm just saying simply that men, there's no place for us to talk. And listen, we have a hard enough time, explaining our emotions or, what we're going through, so now trying to explain our sexual health to our partner, you know, that, fuck. Okay. I don't even know how that works. Okay. Because you can't, most time guys can't explain, hey, you know what, I'm going through, some trauma right now. And this might be what's causing this. Or I'm going through, whatever it is, I'm stressed about
Okay,
pills.
Michael, since we're talking about men here,
Yeah.
let me tell you about the 3 things I've learned I've spoken to close to 200 men over the last 2
Okay.
years about what is really going on in the bedroom. And I have certain questions I ask. So these are fairly standard. So I'm asking guys, what's happening when you lose it? Because again, most guys' problem is they get an erection and they lose it. And there are 3 things that are going on that guys, much we talk about the importance of communication in a relationship. There are 3 things going on that guys don't want to discuss with their partners. Number 1, many women, even when they're turned on, can suddenly start talking about something else, something with the kids, something with the house, something at work.
Yeah.
They've got to get it off their minds. And a man's reaction to that is, WTF? You can't keep this to yourself for 5 minutes. What do you mean? You're talking about your mother right now, and your mother's in bed with us. I don't care if your mother sprained her ankle today. The- okay, so they talk about other things, and this has been a game changer in my marriage. My wife, and by the way, two sisters too. They confessed. They and now with the ring, of course, I don't care because I got a heart. I'm not going to lose my heart on. I've got it. Go. Hey, you want to tell me right now about your brilliant idea to redesign a bedroom? Go right ahead. Because
You got time.
I got time. Right. I'll give you 10, 15 minutes. So that's one. The other one that guys don't want to talk about is boredom.
Yeah.
I'm married 38 years. And there are certain positions that utterly bore me.
Yes.
That my wife likes. Guys don't wanna tell their wives, "You wanna do that right now? I I'm gonna lose it, honey. I'm good for, like, 2 minutes in that position, but it's so fucking boring." But with a ring on, well, hey, you wanna have sex in that position even though you know I don't like it?
Yes.
A few years ago, my attitude would have been one of irritation because my wife and I really do talk about things like, "Hey, I'm gonna lose my heart on in a couple of minutes. You've already gotten yours. I'm waiting for mine right now, and this position ain't doing it for me." It's now, with a ring on, of course, hey, I'm good for 45 minutes. You wanna have sex in that position? Game on, babe. Uh,
Hey,
the
I'll take some of I'll take some of that. Yeah.
and the other one is,
Oh, shit.
now no one wants to tell the guy that, right? They relay that relay that. Now what no, so what's going on? So, and I'll personalize it. My wife has had 3 kids. She's 72 years old. Uh And I'm not 20 years old and turned on. I could have when I was 20 years old, I could probably close my eyes and have sex with a goat, so I'm older, and so what happens? How do men need friction, and there are certain positions, and it
It
could
could yeah.
and commonly it's
Right.
because the woman's older and has had kids. I don't get the friction that I did, when I was younger. The ring changes that. Because of the ring, the penis is harder and more sensitive, and it's a game changer. I had a guy about 3 months ago who'd spent $16,000. He's in his 60s. Wife, they had 5 kids. He spent $16,000 on shockwave therapy and other things, trying to fix his ED that didn't really have. He and his wife would go to
Right.
bed. Typical story. He just goes to bed, gets hard, goes down on his wife because that's how she comes, and that's how most women come anyway as they get older. And then he loses erection halfway, and then she'd want him to penetrate or have sex in missionary position because she ain't putting out because she's post orgasmic. So he would lose his erection, and he found himself, well, I've got ED, and spent $16,000 spent on trying to fix it. He bought our maximum performance ring for $60, and well, now he can have sex in the missionary position again because he's hard, he's turned on, and he's not worried about losing his erection because he's got the ring on. The ring is a game changer, and that's um, and and guys need to open their minds to the value of
Right.
rings.
Right. And that listen, I can tell you, look, it's gonna be a pride thing for most men. You know what? Hey, we don't want anybody to know that we're struggling with whatever issue. And this is why I wanted to have this conversation because again, you're dealing with enough stress, in your daily life. Let's not let sex, be it too.
Sex
You know,
sex would be the refuge from life.
yes.
It should,
Yeah.
and it should be a refuge that guys go to, admit it, almost every day.
Yeah.
And
Hey,
it
listen, I'm here for every day.
yeah, guys don't want we should be guys should not be thinking about cock rings, erection rings as crutches. They should be thinking about them as optimizers. We all
Okay.
want to use optimizers. I've had guys tell me, but it's not natural. Well, do, are you wearing
I,
shoes? Shoes aren't natural. Do you cook on a stove, or are you cooking on sticks outside in your backyard? And we do all
right.
these things that are not natural.
True.
Uh,
Well, ED pills aren't natural.
well, yeah, they have too. But guys, so I mean, my wife's idea of foreplay now is throwing a ring, putting on red lipstick and throwing a ring at me. I'm easy. I'm a guy. Doesn't take much. Uh, I And what does she like about the ring? Because it's better for her, not just better for me, it's better for her as well too. And
Yes.
this is something this and I know that for a lot of guys, it's a hard conversation to have with their partner, but I think that women are a lot more open-minded about it because they're all using vibrators. So if you're open-minded about a vibrator, how about putting a ring on me? Not you, Michael. I'm not inviting you to put a ring on me, but
Yeah, yeah, yeah. No, no.
the
It's okay. Listen, this I usually, like dinner first, at least in conversation. So I got you. I got you. After dinner, maybe we can talk about it. So let's before we close and whatnot, uh let's talk a little more about where sex tech is headed. What do you guys where do you see yourself in the next 5 years?
Sure. Well, we're coming out with a more advanced version of the male device this year.
Okay.
So it's going to be a lot more specific in terms of a lot more. Um, I'll put it this way: right now, there's a certain fuzziness. It's same thing like like a blood pressure cuff here. People don't know this is a blood pressure cuff that you have at home, but it is a 5 to 10% variability. Is my blood pressure 120 or is it 125 or is it 115? There's a variability. We're
Right.
eliminating that variability with our next generation coming out with this year. We're also going to be able to tell people about the quality of their sleep because every episode of quality sleep is accompanied by an erection in a healthy man. We'll also be able to monitor the cardiac rhythm overnight, and then we're going to be able to see what's people will be able to see what positions they're having sex in, how many calories they're burning. So we're coming out with an advanced device for men, but we're coming out also with the world's first monitor of the health of the clitoris because just the way in men it's all about blood flow, in the clitoris it's all about blood flow. Women's
Really?
sexual health revolves around blood flow. Hormones too, but the hormones drive the blood flow. So yeah, really. So women have nocturnal full erections, and no one. And when our thesis is that they're just as significant in a woman as they are in a man, and I mean that they're indicator of their cardiovascular and sexual health.
Right. All right. So, Dr. Justin, what do you say to father or a husband who's taking care of everybody else, but is not taking care of himself because he's
It,
too
it's
embarrassed, whatever?
it's use it or lose
Y-
it.
Okay.
And men need to um, approach their their fitness the way they would their regular fitness. If you got into bad shape, and you don't just suddenly say, "Hey, I want to be in good shape," and I'm going to go to the gym now. And what am I going to do? No, it's not spontaneous. It's planned. You don't get out of a rut without planning. And that's why if a man has fallen into the situation of postponing sex and he's lost his confidence, he needs to approach it just the way a guy would who's overweight and poor cardiovascular health. You don't. It's not going to happen spontaneously. It's going to take some discipline to get out of that situation. And
Okay.
men need to plan for their sexual pleasure and their sexual health the way they do plan for other areas health of their health.
And I think we need to just be able to be more open about it. And I know that we don't all have a partner that is pliable where we can talk to them about these types of things.
Your right hand's your partner.
Well, I'm left-handed,
Okay. Well,
but I am fairly talented. I could be a switch hitter if I needed to. You know, for me, listen, I've been married 20 some odd years. I'm pretty blessed that I don't ever have to say my wife says no. You know, I'm pretty fortunate in that department. If I want to, she wants to. So she's like, hey, well, I'm not going to deny myself just because I'm mad at you. No, I can still be mad at you after.
I like that attitude.
I'm like, all right, cool, let's
Yeah.
go. So, all right, final question. Where can people find all the information about sex tech and everything that you do?
Sure. You can go to myfirmtech, myfirmtch, myfirmtech.com. If you click on the science button and then click on research, you can see all the papers that have been written about or being written about how our device can make sexual health objective and give men life-saving data about the vital signs of their sexual and cardiovascular health. You can also contact me personally at Elliot, Elliot at myfirmtech.com.
Okay. I'm going to add all your contact information when our episode airs, which will probably be next Wednesday. So,
Cool.
Listen, Dr. Elliott, thank you so much for coming on the show. I'm probably going to get a bunch of follow-up questions. People mostly they inbox me because they don't want to, leave a comment on the Facebook page. So, but if you get an opportunity, I'd love to follow up with you again. And hey, maybe maybe I will be a customer myself.
Well, how about
No fault.
your data versus my data? Make a competition.
Okay. Hey, oh my God, hey, guys love competitions.
Who's the firmest listener to Michael Darden's show?
All right, ladies and gentlemen, Dr. Elliott, thank you so much. Okay, listen, I can